I'll start recording now, and I'll introduce you to the house rules. So as I already said, today's seminar is about human factors in everyday healthcare and end hygiene. Is going to be run by Dr. John Kyle, Alison Kay, and Vivian Howard from Trinity College Dublin. I recommend everyone that to keep your microphone on mute, and maybe if possible, actually provide your questions into the chat section if possible, so that will avoid having background noise and facilitate everyone in listening and for the recording. If you have any questions for the presenter and you cannot use the chat function, feel free to maybe raise your hands or actually in the section part of the meeting to actually ask them also with the microphone if useful. We will be recording the meeting, and the recording are going to be made available on the member section of the Society website, www.ihfes.org. And I recommend that all of you consider joining the Society as affiliate as member, and this will help you benefit from this type of activities as well. I'll pass on the word to Joan actually, and you can start presenting your screen, Joan, and present yourself as well.
Okay, well, firstly, welcome everyone, and thanks to the Irish Human Factors and Ergonomics Society for giving us this opportunity to disseminate our research. Welcome to what we are describing as a lunch and learn experience, and this includes the group of people who are here now who are present with us, and those who I think will be joining us later watching the video recording. So a number of our colleagues in the project, and also the people we wish to disseminate to, particularly healthcare workers, are busy working in our hospitals and in our healthcare system, and hopefully we'll get to see this later. Now, obviously, this presentation is relevant to everyone. It's for workers and non-workers alike. We are sharing an experience. We're having 30 minutes together to learn about mindful hand hygiene. And this is a really positive step. And the key part of this is the practice, and we'll take you through the practice. So I just want to introduce myself first. My name is Joan Cahill. I'm a human factors researcher at the Centre for Innovative Human Systems at the School of Psychology in Trinity. And my research is, I suppose, between behaviour science, ethics and human factors. And next, Alison.
Hi, my name is Alison Kay. I am a human factors researcher at the Centre for Innovative Human Systems. My background is occupational psychology, and my research involves looking at the human and safety critical systems and designing the work environments to support worker well-being. And that's me.
And Vivian.
Hello, I'm Vivian. I'm a health psychologist with a background in psychotherapy. I have been working as a human factors researcher for the last year or so, and I have worked on this project as a research assistant.
Great. Well, thank you, Alison and Vivian. Okay, we'll continue. So the title for this presentation is Human Factors in Action, Mindful Hand Hygiene, Promoting Wellbeing, Self-Compassion and Safe Performance. And I suppose much of the concepts around what we're trying to deliver with the practice are encapsulated in this title. So for my part, I'm going to give you a background to the project and explain some of the I suppose, the theory and concepts which inform the practice, particularly looking at well-being, self-care and mindfulness. And then my colleague Alison will take us through mindfulness in work and moments and opportunities for mindfulness, and the overall rationale for how we were using mindfulness as a stress management strategy, but also to deliver self-care and safe care. And then my colleague Vivian has her hand gel, which I hope everybody has too, and she's going to take us through the mindful hand hygiene practice. And this is really the core part of this presentation. This is the experience. We want everyone to practice together and learn about mindfulness, and really to pick up this message that mindfulness is something that you can embed in everyday tasks, and to find a path forward in our busy lives for practicing mindfulness. Then we'll come back to me, and we'll have a little maybe debrief, and if anyone wants to give some feedback and questions, and we'll share some final information and posters around the practice.
So the mindfulness approach was developed in the PPE Safe project, along with different clinical learning and technology partners. This project was sponsored by the Science Foundation Ireland. The team includes Trinity College Dublin, Learnovate, 3 clinical partners, Beaumont, Bon Secures and Tala, and ShareWash. Much of the story of the project is communicated in these pictures. So we see the challenges of healthcare workers in terms of donning and doffing PPE, challenges related to workload, equipment, providing compassionate care. So obviously safe donning and doffing is very important in terms of both staff and patient safety. And the lived experience of donning and doffing PPE has led to, in many cases, to burnout, to fear, to changing team dynamics, and also to changing care delivery. So the interaction with the patient is different. And there's a large conversation around empathy and compassion fatigue that needs to be addressed. So in this project, we looked at combining mindfulness and hand hygiene as a stress management intervention, but also to promote safety. And I say we feel that this will lead to benefits at different levels, both for staff safety, patient safety, and for family members, so that they know that staff are in a good place to deliver safe and quality care. So just to call out some of the concepts, firstly, well-being. So this is looking at the well-being from a biopsychosocial perspective, integration across the 3 pillars, the biological, the psychological, and the social. Also looking at the relationship between well-being and safe performance. So as we know, wellness is a protective factor. It has outcomes for the person and for others. So for example, co-workers, patients, and family members. And self-care is an important feature of wellness and work. And there's obviously a role for individuals to foster and practice this, but equally there is a role for organizations to support self-care and enabling this as a practice in terms of rosters, training design, having the right culture. So I'll now move to Alison.
Hi, we are asking 3 questions here. Why mindfulness, why hand hygiene, and why hand washing? Well, mindfulness, as we know, has been very successful in reducing stress, but also when we've looked at mindfulness at work, brief mindfulness interventions have had a positive impact on healthcare workers' stress, anxiety, and resilience. And we know that from Gilmartin et al. In 2017. Why mindfulness? Well, it provides a much needed time out to pause and prepare ourselves for the next task ahead, and an opportunity to bolster resilience in the face of great trauma. And we know that COVID has provided great trauma for healthcare workers globally. It's also an opportunity to promote well-being and self-compassion. As well as mindfulness at work, we know that mindfulness-based stress reduction can be tailored to healthcare settings, and we know that from Zeller and Levin in 2013, Sankar in 2019, and Knudsen et al. In 2020. Bern Mulcahy from the Bon Secours Hospital in Cork, she's the Director of Nursing, and she was responsible for implementing mindfulness hand hygiene in cardiology. And we also know that mindfulness hand hygiene has been successful in trauma care and emergency medicine. From the Ebola outbreak and from SARS, the literature has suggested that we need adequate support for healthcare worker well-being and mental health to mitigate for post-traumatic stress disorder. And having spoken to professionals over the past year who are involved in supporting healthcare workers during COVID, we know that this is really important. We were privileged to attend the Nursing in a Pandemic webinar organised by the Royal College of Nurses in the UK in November last year. And there were 2 particular speakers who spoke out to us about wellbeing. And the first was Chris Carter. He's an academic and teacher in Birmingham University, and he also headed up the ICU in Lewisham Hospital when the COVID first broke out in London. And he has a background in the army, and his message was that post-traumatic stress disorder can impact people much further down the line. So for example, in 2 years from their first exposure.
So his message was, we're in this for the long game. Rose Gallagher, who was the professional lead for infection prevention and control, said that we have to capture this moment, but we have to do it in a meaningful way. She was involved in Ebola, and her message was that we have to look after healthcare workers' well-being, and we have to do it now. So we have to be looking after it in the short, medium, and long term. So we've looked at mindfulness. Why hand hygiene and hand washing? Well, it's a high frequency task that's done throughout the working day. So every single individual that comes into a hospital must wash their hands either with gel or soap and water continuously throughout the day. It can be done in between patients. So it actually follows the 5 hand hygiene moments that the World Health Organization have set out, and it follows their steps for hand hygiene. There are also 2 golden moments that we found. One is before the shift, preparing yourself for the shift ahead, and at the end of the shift, before you leave the hospital. This also reinforces the correct hand hygiene practice as per the World Health Organization steps. Joan, if we can have the next slide, please. So brief mindfulness interventions have successfully impacted stress, anxiety, and resilience in a positive way from Gilmartin. One thing that we will look at in our next step of this research is the dosing of mindfulness. Some of the literature has suggested that it could be done 5 to 10 minutes a day. We were suggesting that it's done for a period of 30 seconds approximately every time you wash your hands throughout the day. So we'll be looking at the dosing of those. And some of the studies also had a 4-hour session and training on mindfulness. So we'll be delighted to be looking at that and how it can be implemented in hospitals in Ireland. If we could have the next slide, Joan, please. So the moments and opportunities for practicing mindfulness at work is not just in healthcare settings. It can be done in any workplace because we all have to wash our hands much more than we used to. We can follow the 5 moments that's done in healthcare. And one really key thing would be the golden moments. So before we start our working day, that can be as we're washing our hands before we leave the house. It could be done when you get to work at your workplace, or it can be done in the house if you're working from home. Another opportunity would be when you're traveling to work, using gel on your hands on the bus or the train. And another key one would be as you are preparing to leave your workplace. So whether that's a hospital or a factory, or you're closing your laptop and you're at your desk at home, it's a key moment to practice mindfulness and practice well-being and self-care. Could we have the next slide, Joan, please? So we have produced 2 hand hygiene posters as part of the PPE Safe project. And these have been validated with a number of mindfulness experts and people working in healthcare, either in a hospital setting and allied health professionals or in the community care setting. And they told us what would work from their perspective in terms of the amount of information presented, how it was presented, and this is what we have come up with. As you can see here, there's the mindful hand hygiene at the bottom of the slide, and that is the link to this web page where you can access both of these posters, one for using at a sink with soap and water and one for using with gel. On this website, there is also some information about mindfulness itself and links to other mindful resources which you might find helpful. And without further ado, I'll hand over to Viv, who will take us through the mindful hand hygiene.
Thank you, Alison. You might like to have your hand sanitizer convenient. In the hospital context, this practice would take 40 to 60 seconds, but for our purposes today, will take a little bit longer. For those of you who are not familiar with the hand hygiene procedure, you can focus on the illustrations to follow the technique, and I will read the mindfulness instructions. Thank you, Joan.
So first we stop. We take a deep breath, observe and acknowledge what is here right now, our feelings, our emotions. We proceed with the task of hand hygiene, taking this opportunity to step away from autopilot and allowing for a moment of self-care and self-awareness. The mind may wander. That's okay. That's what minds do. Noticing the mind wandering is the moment of mindfulness. If you could take a couple of squirts of hand sanitizer, noticing the feel and texture of the gel as it touches the palms. Bringing awareness to the feeling of the palms as they touch one another. Noticing the sensation in the fingers as they intertwine. Bringing awareness to the feelings of the intertwined fingers. Allowing the awareness to come to the clasped hands, rotating from side to side. Feeling the touch of the hands and the thumbs together. Noticing the feeling in the fingers and palms as they rub against each other. And allowing the awareness return to the body as a whole. Feel your feet rooted to the floor, noticing what is here right now. Thank you all.
Thank you, Vivian. Well done, everyone. We hope that was a good experience for you. We're curious to figure out what you thought of it. Is it something that you think you might be likely to try another day again? Well, we've had lots of positive feedback from healthcare workers in Ireland. I'll let you just look at the screen here and read some of the quotes. If you would like further information about the mindful hand hygiene and mindful hand washing approach, as Alison mentioned earlier, you can go to our project website, and also the Irish Human Factors and Ergonomics Society have a members area, and they will host this presentation and the different posters for mindful hand hygiene and mindful hand washing. So we might see if there's any questions, Chiara. I think some of the questions are going to happen in the chat. So very curious to figure out your responses. There are some references if anybody would like to look at later. And if you want to contact us for any follow-up, that is, of course, very welcome.
Thank you, Joan, Alison, and Vivian. And I'm sorry if the presentation slide didn't follow exactly the timing correctly, but I think it was useful to, even just to, for a moment of our time, to step into the shoes of the healthcare workers that you've been dealing with. I'd like to see if there are any questions from the audience, but I do have a questions on my own side, which is to say, when you started this work with them, what was the immediate let's say reaction and need that you notice into stepping into this idea of mindfulness in their daily work?
Well, it certainly was very positive. So if you can, it's very hard for people to put themselves in the shoes of healthcare workers. But I know we all at different points in our life, maybe attend hospitals or have family members. But right now, healthcare workers are very time stretched. They're quite burnt out. It's been nearly a year that they've been delivering care in this COVID environment, and wearing PPE and having their working environment so changed has been challenging, and they've really been doing a great job. And introducing mindfulness was received both as a recognition of the need and the challenges, and also as something practical and operational. So very, very positive. But obviously, you know, there's complexities in terms of asking health workers to focus on themselves and take a moment, and yet also expecting them to deliver care. And there can be some contradictions there. So really, this research needs to unpack some of those and look at both the practices at an individual level and how healthcare organisations can support this.
There is a question from Marie Ward that thank you for the session, and ask, what was the most common benefit that care workers noted?
I think self-awareness, and even the, you know, the benefit of recognizing where you are in the moment, and that pause. And what was welcome was the sense that, you know, this is actually okay. This is something that is required, and it's something that will deliver a benefit in terms of safe healthcare delivery. So if you help yourself, you help others, and that's a very positive message. I suppose it's the oxygen mask message that we would be most familiar with more generally.
And while I wait for the other, there is another question coming up, but while I wait for that, was this rolled out? I saw that there were 2 hospitals, and they are COVID hospital, where this was rolled out in, but was it rolled out in specific moments, or how did it work out concretely in the way it was applied in the wards?
So at the moment, this research is still continuing, and it isn't fully implemented. What we've done is we've evaluated the practice and we've refined the practice based on feedback from stakeholders. So it's been rolled out in different care contexts. So at Tala, it's the emergency room and theatre. In Bon Secours, it's on the ward, and with Beaumont, some health infection management nurses have rolled it out across different wards. And really, the focus has been on mindful hand hygiene, which is linking into donning and doffing PPE.
And the other question I got from Isabel McGregor is, was healthcare management supportive of the initiative? I suppose, how did they demonstrate their support?
Yes, there has been some considerable support from healthcare management. I mean, this is a funded research project, and the idea is to, you know, develop requirements and understand the practice. So the next step is for, you know, healthcare management to support and enable the rollout of this as an implementation. And I think that's where healthcare management support would be tested.
Mm-hmm. And I noticed that the title of the project is PPE Safe Project. So is this going to be rolled out also on other type of PPE usage? And
yes, absolutely. So our funder is Science Foundation Ireland. This was part of the COVID Rapid Response Programme, and the idea is to implement the same across healthcare facilities in Ireland and internationally, and to share the practice. And you know, in terms of the more global picture, these mindfulness practices are becoming increasingly more acceptable in healthcare environments as practices for staff, not just for patients.
I have 2 questions from the audience, but I can invite Katie and Marco if you want to even speak up your questions. So, Katie, do you want to go first?
Hi, it was more a comment. Hi, everyone. Just to say that it's kind of it's interesting that a simple reframing there. Like I would find that kind of mindfulness if I was doing something self-care related, like applying hand cream or something. I would kind of adopt that approach, but it wouldn't have immediately come to my mind to do it for something that we're doing all the time now, so much more, like with hand gel. And I think it's just a nice kind of quick kind of reframing to introduce some of that kind of self-care and me moments throughout your busy day, because it's something we all have to do anyway. So to take that time to just kind of have that moment to yourself, it's nice to just kind of a simple reframing trick that can maybe make your day a few moments more peace in your day.
Yeah, absolutely. Well, thank you for that, Katie. And I think one of the big messages coming from this project is that, you know, when we think of mindfulness and self-care, we think that you have to pause or stop in a greater sense, and that you have to, you know, get into a relaxed frame of mind and be somewhere that's physically suitable, you know. And the thing is, in life, there isn't, you know, these opportunities don't present themselves. So you have to take the moment and build it into your everyday activities. So hand hygiene at the moment is an everyday activity, and this makes it accessible. So you have to build a practice into what we do. And I suppose from our perspective as human factors researchers, we would say that's operationalizing mindfulness.
So there are the two last questions. So from Marco, the first, Marco, you very welcome to voice it yourself, or I can voice it for you.
Well, it's a quite simple question. Very nice topic and so on. I wonder how about following something similar in other countries? You are aware of anything similar to your work?
Yes, I suppose our closest partners, in the NHS are rolling some similar research out. My colleague Alison is most close to it. Indeed, the other day there was a big conference that she mentioned where it was looking at putting the healthcare worker first and looking at, all forms of self-care activities. Maybe Alison, you'd like to comment.
Thank you.
Hi, yes. There's the World Health Organization have announced that this year is the year of the healthcare worker, and in terms of providing safe practice to patients, they were stressing that every year should be the year of the healthcare worker. And there was a conference looking at healthcare workers' well-being a couple of days ago, and it seems like when we put our hand hygiene message out there, that it was very positively received, and it was considered quite novel. So it's very positive, and we've actually had a number of inquiries from Germany and India and different countries in Africa looking at how they can try and implement it themselves, which is really positive.
We have to close, but I think there was a question for Margaret, and just to let you know, Marco is from Slovenia, so that's the idea. We can reach other countries in Europe as well, in continental Europe. So Margaret was asking how many workplaces is delivered already, and how many staff, and what type of staff, and how was it checked that it might happen on the ground?
Well, it was done across the Bon Secours, Beaumont and Tala Hospital. I think there are probably around 120 people in total, Joan, across the 3 hospitals, around that.
Yes.
And it wasn't fully implemented. That is our next stage of research to look at that. And it was in terms of managing it, and it was self-checking, so it's not been formally rolled out yet, and that's our next steps in terms of the research.
And one of the things that we'd like to do, and we feel is very important, is because sometimes mindfulness for everyone doesn't sit in a very kind of scientific space. So we will be doing an intervention and treating this as an intervention and measuring well-being and trauma, and looking at some of those protective factors for healthcare workers prior to a formal implementation of mindfulness, and then measuring afterwards. And we are quite confident to see some positive improvements in well-being, but also in terms of a safe performance for donning and doffing, less errors, because if you're in a safe space, and equally seeing improvements in the quality of care delivery. And certainly in these challenging COVID times with lack of touch and difficulties with eye contact if goggles are being used, and masks, that we can still have healthcare workers that have the ability to deliver compassionate care irrespective of the PPE. So if we look at those pictures again, Chiara, that we had at the start, this is really the space we're in, and we'll measure. Very good.
And I wanted to say, Shivana is proposing that this can be rolled out to other sectors like education or schools, where a similar practice could be rolled out to.
Absolutely. It's relevant to all workers, all contexts. We're all doing this, and we all need mindfulness, and we all need a moment. And even just the message of finding time within your busy life, and not time outside, time as part of what you're doing. So I think that would be of use for everyone.
So I'm glad that we can make this recording available for some of the health workers that collaborated with you. And actually, it is the year of the health workers. And in fact, our next webinar session is going to be dedicated to them again. and it's going to be about building resilience for nursing and midwife personnel, and it's going to be by Dr. Sam Comey. So I'm really grateful for your session today, John, Alison, and Vivian, and to the audience for being here and contributing to the webinar. And looking forward to the next one, and to maybe hearing feedback about how this project is going to be developing in the near future. Thanks for today, guys, and enjoy the rest of your lunch break. Okay.
Thank you. Thank you.
Thank you. Bye-bye.
Thank you. Bye-bye.
Thank you. Bye-bye.